Good morning. Yesterday, Haiti's Ministry of Health began a targeted, staged vaccination campaign from the Pan American Health Organization, the World Health Organization, and UNICEF, and several non-governmental agencies and partners. The campaign consists of tetanus vaccines for the more than 200,000 who have been wounded or injured since the earthquake, including many surgery patients. These tetanus vaccinations have been well underway for the past several days. The second stage, though, began yesterday and targets approximately 250,000 children under 7 years of age living in the temporary settlements, most of them in Port-au-Prince. They will get the combined dose of diphtheria, tetanus, and pertussis, and children over 9 months of age will also receive measles and rubella vaccinations and vitamin A supplementations. Reports from medical teams on the ground continue to show a declining number of trauma injuries requiring treatment. We know more children are suffering from diarrheal disease, particularly in these resettlement areas, and existing mobile health units and standing health facilities are responding. We are now 22 days out from the earthquake that's crushed Haiti, and as we predicted, it has become increasingly clear that people are requiring more mental health support to cope with this tragedy. Mental health experts have been deployed, and special training and support activities have been launched around the metropolitan area of Port-au-Prince. As part of its coordinating role, the Pan American Health Organization and the World Health Organization has created an online volunteer registry to collect information on health workers interested in volunteering in Haiti. The registry includes data on people's experience, skills, and availability, as well as their contact information. Candidates must be fluent in French, and Creole is also an asset. Currently, the most needed areas of expertise are public health, medicine, and disaster management. Potential volunteers can register online at the PAHO website, www.paho.org/Haiti volunteers. Information from the registry is circulated among the agencies already working in Haiti, and if a volunteer's experience and skills match the identified need, the applicant may be contacted by that agency to provide support. In collaboration with the Clinton Foundation, a separate database of medical human resources already available in country has been created by the PAHO WHO-led health cluster. Haiti's Ministry of Health has requested all partners working as part of the health cluster register their organizations and more details about exactly what medical resources they have and what they're providing with the ministry. The ministry has also asked that all health teams let the ministry know when they are leaving the country so that other agencies can be mobilized in their place to ensure continuity of care. As I have said before, coordinating closely with the Haitian government is critically important to ensure that the efforts of volunteers, both individuals and organizations, support actual needs and respect existing administrative processes. This coordination and respect for the Haitian Authority will be important in the longer term as well. As our director, Dr. Mirta Rosas, said on her return from Haiti last week, Haiti's recovery and reconstruction will be successful only if there's a long-term commitment from the international community and if the Haitians themselves are allowed and empowered to lead the process. To that end, the PAHO-led health cluster supports the Ministry of Health by convening daily meetings at 4 p.m. We know that more than 135 agencies and non-governmental organizations are participating in this activity. Sub-cluster working groups have also been formed and meet regularly to coordinate the broad areas of work covering, for example, epidemiology and surveillance, primary care, including the operation and management of the mobile clinics, prosthetic devices, reproductive health, and mental health, as I mentioned. From our staging base in Jimini, in the Dominican Republic, located along the Haitian border, PAHO WHO logistic and supply system has classified and organized more than 400 tons of humanitarian supplies over the period January 22nd to January 31st. Another one of the ministry's emerging concerns is to resume the long-term care for patients who were undergoing treatment for conditions before the earthquake, particularly the HIV/AIDS patients, since treatment has been interrupted for many of these patients. And here again, supply management remains essential. Staff from the Haiti's National Program for Control of Malaria, Lymphatic Filariasis have met recently with partners from CDC, PAHO WHO, and others to discuss a strategy for vector-borne disease control. They are drafting an advisory note for all partners in each of the UN cluster groups and will distribute copies of protocols for the diagnosis and treatment of malaria, dengue, filariasis, and other vector-borne diseases. I'll stop there and address any questions that you may have, and thanks again for coming.
Hi, good morning. I'd like to know if you uphold the mental health right now as the first concern in among the Haiti population. Is the mental health the first worry for the organization?
It is a priority. I wouldn't classify it as number one. In a response to a disaster like this, life-saving search and rescue efforts were essential, and then the treatment, the acute care and treatment of persons having injuries and requiring surgery was also a top priority. But the mental health cannot be neglected. And again, I wouldn't say it's the number one priority, but it's emerging in its importance and in the critical need to provide those kinds of services so that the community can respond and continue their family support.
Okay, any other questions from inside the room? If not, we had one from the New York Times who was asking about if we foresee the rising threat of a disease which was already a major problem in Haiti, which is tuberculosis. This correspondent said, we visited the country's only TB hospital, where most of the patients fled and are now living on the streets and without their medications. I wanted to find out what steps are being taken to handle the TB problem and whether we have concerns about resistant strains of TB spreading.
And those are great questions, and certainly tuberculosis is a major concern, as is the other chronic medical conditions. I alluded to HIV/AIDS. Tuberculosis is another one of those conditions that require ongoing long-term daily treatment and management. The mobile response teams that are visiting the resettlement areas, the newly constructed health posts, they're all on alert to try to identify and respond to patients that have had tuberculosis. Are we satisfied with the effort? No. There's a lot more work that needs to be done as we enter a phase where the primary care health services need to be reestablished. It's work in progress, but it's certainly a top priority. Tuberculosis is an infectious disease that can spread rapidly, particularly in the conditions that exist in the resettlement areas. So it's high on everybody's concern. From our side, in managing of medical supplies at the PROMES, we are stocking and providing the medications necessary. But those outreach clinics, I think, are also a critical component of the follow-up and action.
Okay, thanks. And then we have another question about dengue and malaria, do we foresee problems with dengue and or malaria in Haiti?
We do, and that's why a meeting was convened in the vector-borne group, the group in the Ministry of Health with the Centers for Disease Control in Atlanta, PAHO, WHO, and other partners to respond to the risk of emergence of dengue and malaria. We know in April the rainy season will come, and that will contribute to that risk as well. So vector-borne disease control will be an important strategy and will require the follow-up that is currently being coordinated.
Please say more about the vaccination campaign that started. I may have missed part of that. Vaccines against what diseases, how many doses, who is administering the shots, where they will be given, camps?
That's a great question. To add to what I said, the response, there's always been a concern about low coverage of vaccine-preventable diseases, particularly among children less than 5 years of age. And so with that being a problem even before the earthquake, it's important that we address and reestablish immunization services. So to that end, the first stage is to do targeted vaccination campaigns targeting those resettlement areas. There are some 250,000 children under the age of 7 years of age living in those resettlement areas. So they will receive doses of the diphtheria, tetanus, and pertussis vaccine. That will be repeated. They should have at least 3 doses, and so the idea there is to repeat those activities for at least 3 times, but it will be ongoing work throughout the long-term strategy. In addition, children over 9 months of age will receive the dose of the measles rubella vaccine. While we're doing these activities, we'll also provide other health interventions, and I mentioned vitamin A to the extent possible. So those are that's the initial phase of reestablishing the immunization services that are so essential in primary health care.